Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute versus the subacute endocarditis. So first we look at the acute endocarditis. So in terms of acute endocarditis, what are the organisms? In acute, it includes the Staph aureus. So it includes the Staph aureus, and next there is also presence of the stormy onset. So there's presence of the stormy onset. Next is it includes the necrotizing, ulcerative and invasive valvular. So it includes the necrotizing. So it includes necrotizing, it includes the ulcerative as well as the invasive valvular. Invasive valvular. Now what are the other things? The infection on a previous normal valve. So there can be infection also. So this infection is on a previous normal valve. Previous normal valve. Now let's look at the other point, that there is a difficulty to cure with antibiotics alone. So in terms of curing with antibiotics alone, it is difficult. Antibiotics alone. So when you're looking at antibiotics alone, it becomes very difficult. It becomes difficult. Next, in terms of it usually what it does, it requires a surgery. So surgery is required. Next is when you look at the destructive valvular lesions. So there is presence of the destructive valvular lesions, and in histopathology there is presence of fibrin. So histopath there is presence of the fibrin. Next is there is presence of the inflammatory cells. So fibrin is present, inflammatory cell is present, as well as presence of bacteria. So all this in terms of the acute type. Now we look at the subacute type. So here in the subacute, so subacute type, the organism involved is the Streptococcus viridans. So there is Streptococcus viridans. So in terms of acute, it is Staph aureus. Here it is Streptococcus viridans. And in subacute, the onset will be insidious onset. Whereas in acute it was stormy onset. Here it is insidious onset. And when you look at the subacute, what are the types? The types is it is a protracted course on a previously damaged valve. It is a protracted course, and this is on a previous damaged valve. Previous damaged valve. Next is the difficult to cure with antibiotics. In terms of acute, it was difficult to cure with antibiotics alone and usually requires surgery. Whereas in terms of subacute, it can be achieved with the antibiotics. So in subacute, it can be cured along with the presence of the antibiotics. Next is in terms of acute, there was destruction of the valvular lesions. And now in terms of the subacute, in subacute type, what is present? So in terms of subacute, there is a less destruction of the valves. There is less destruction of the valves. And on histopathology, the acute, it had the fibrin, inflammatory cells and the bacteria, whereas here in subacute, histopathology shows the granulation tissue. So this presence of the granulation tissue, and this granulation tissue is present at the base, indicative of healing. So it is present in the base, and this is indicative of the healing. So in the base, it is indicative of the healing. To learn and grow daily like this, please do subscribe.